What's up, everybody, and welcome to this week's edition of Davinci Cases. This week we cover a case featuring high-yield spine anatomy concepts and a corresponding radiology image. Alright, so the way this works is there's a clinical scenario with a board-style question at the end of it. Before we jump in and answer the question, we're first going to go through the case, point out the relevant clinical findings, and then go through the relevant anatomy, and then use that to answer the question. Alright, so the first case here, we have a 47-year-old man. He presents to the clinic complaining of severe low back pain that's radiating down his left leg into his foot. So he's got low back pain, unilateral sciatica into the left leg, all the way down to his foot. Could be suggestive of some spinal nerve impingement, possibly a disc herniation. The fact that it's only one side makes us lean away from spinal stenosis, but let's keep reading to confirm. He also experiences intermittent numbness in his foot, so that also corresponds to nerve impingement. He exercises 5 times per week and has a BMI of 24, so he exercises a lot. He's a thin guy, so this means he's in pretty good shape. He's not a smoker or uncontrolled diabetic with hypertension. Even though he's not a young guy, he's still a middle-aged guy, but in really good shape. He exercises a lot and is a thin guy. Stretching and NSAIDs have not provided relief. That's suggestive of that it's not just some musculoskeletal strain, because usually that gets better with stretching and NSAIDs. His primary care physician has ordered an MRI that is shown to the right here. So we'll go over this image in a second here. Let's just look at the question. Which of the following findings is the patient likely to have on physical exam? So this is a secondary level thinking question, or even tertiary level. It's asking you to find the diagnosis, but then based on the diagnosis, what you would expect to find on physical exam to confirm that, because notice that the exam is not given here. So the first thing you need to do is figure out what is the diagnosis based on the imaging. So let's look at the imaging here. First, whenever you look at a radiology image, you want to first determine what is the image. So in this case, it's an MRI. It's a sagittal view. So it's a sagittal MRI. And with MRI, you want to be thinking about T1 versus T2. T1 highlights more so fat. T2 highlights water, so water is going to light up. So you notice this portion right here is lighting up. This is the dural sac. What's in the dural sac? CSF. What makes up most of CSF is water. So that gives you a T2. So this is a sagittal T2 MRI of the lumbar spine. The other thing is the nucleus pulposus has a lot of water in it as well, so it's going to light up on a T2 as well. That's another clue for you as well. Also, you'll see fat depressed as well on a T2 image. So with the lumbar spine, I actually like to start at the bottom when you're labeling these. So you can see the sacrum because they're fused like this. So this is your S1, this is your L5, or L4, you can see that better out here, L3, L2, and then this little sliver here is the bottom half of L1. So we have the whole lumbar spine here, and then we also have the sacral spine. This would be S2 as well here. So we're coming down here. The disc height looks pretty healthy here, here. It's pretty open. The canal is pretty open here. You don't see any significant compression or stenosis. Still looking, there's a minor bulging maybe there. Nothing too crazy though. It's actually, if you took an MRI of a lot of healthy people out there, you would probably find incidental minor disc herniations that are just asymptomatic. Anyways, we keep going down here. Now this is what we're looking at here. This is a large disc bulge protruding out into the dural sac here, likely compressing a spinal nerve, and that's what's giving our otherwise healthy, active guy his symptoms. And often this is all it takes, just a little spinal bulge like this. And then you can have severe weakness, severe numbness, pain, even in a healthy guy like this. So, and then if you look at the levels here, it's between L5 and S1. So it's a disc herniation at the L5, S1 level. So here's the diagnosis. We have that now. Now we need to figure out what nerve is impinged. So we need to do diagnosis, nerve, and then based on the nerve, then we can know what the exam. Because the exam, especially on these USMLE exams, is going to correspond to specific nerves. All right, so to help localize which spinal nerve is impinged, We have a diagram here to go over that, the spinal nerve anatomy and the lumbar spine. So this is a posterior view. Remember, the spinal cord ends at about L1, L2, somewhere in there. Depends on what book you read. So you're going to have the conus medullaris here, and then the cauda equina. So you have the nerves coming down like this. So L3 is going to come down and exit just below the L3 pedicle. So remember, in the lumbar spine, spinal nerves come down and they exit just below the pedicle here. Remember, in the cervical spine, so let's say this is C5, the C5 nerve is going to come down and kind of exit at a 90-degree angle above the C5 pedicle. So we keep going down here. L4 is going to come down like this and then exit like that. And it exits at this oblique angle just like L3 and the other ones, just below the pedicle corresponding to the same numbered vertebrae. So L4 comes down like that, L5 comes down like that, and then S1 is going to come down like this. And S1's a little different because it has those sacral foramina, and it's going to go out through that and then come out in the anterior portion here, S1 like that. So if you have a disc herniation at L5, S1, you can see that the nerve that's most likely to be impinged is the S1 spinal nerve. So you see with L5, I mean, it's already left at this angle here. It can't get affected. And so S1 is still coming down. It still has to exit, and it's going to be impinged by this L5, S1 disc herniation. So we figured out the diagnosis. It's a lumbar disc herniation. We figured out the level. It's L5, S1. The imaging told us that. This is L5. This is S1. Here's our disc herniation here. And then it's an impingement of the S1 spinal nerve. So now we need to figure out each of these physical exam findings, which spinal nerve they correspond to. So difficulty walking on their heels. So when you ask someone to walk on their heels, you're testing what? You're testing ankle dorsiflexion, because that's what enables them to keep the tip of their foot up and allows them to walk on their heels. Ankle dorsiflexion is the L4 spinal nerve. So if that's out, that corresponds to the L4 spinal nerve being impinged. Hypoactive patellar tendon reflex. This is hypoactive if the L4 spinal nerve is impinged. Difficulty walking on their tiptoes. So versus ankle dorsiflexion, this is ankle plantar flexion. Ankle plantar flexion corresponds to the S1 spinal nerve. Makes sense here. Let's keep going here. Hypoactive Achilles tendon reflex. That also corresponds to the S1 spinal nerve. So if we look at this here, A and B would essentially L4. C and D is essentially S1. Well, we know it's an S1 spinal nerve impingement, so it's not likely A or B, and as by default, it's not going to be E or G, and it's not either C or D. He's likely going to have both of these. And that gives us our right answer here of C and D. All right, that's all I have for you this week. Make sure you check back every Wednesday for new Davinci cases. In the meantime, subscribe to our channel for more videos, and then be sure to download the PDF notes for this video on our website at dviacademy.com. Also on our site, you can find our book and video packages for anatomy and biochemistry. And if you want to listen to Davinci cases on the go, the audio is available on Spotify. You can also follow us on Instagram for weekly posts and video. And then lastly, if you have any questions about the content of this video or about Davinci Academy, put them in the comments and our team will be sure to answer them. All right, thanks for watching. We'll catch you next time.